I was still unsure how such a big mistake could happen, so I took my concerns to the Arizona Medical Board. I filed a complaint against Dr. Michael Maxwell. I received a letter October 15th of 2010. It read, "The board's investigation staff has thoroughly reviewed the information you provided and does not find a violation of the Medical Practice Act in the Arizona Revised Statutes. Therefore, the board has dismissed your complaint. Thank you again for assisting the Arizona Medical Board in meeting its mission." I filed a request to have the board reopen the case against Dr. Michael Maxwell. December 9, 2010, I received correspondence from the Arizona Medical Board. This letter is to inform you that the case has been reopened. I received a letter stating that the case would be reviewed on April 6 and I could prepare a 3-minute speech. January 20th, 2010, I went to the emergency room with pain in my back from my shoulder to my waist, all 10 of my fingertips numb, fever, and chills. The emergency department reported I had a sudden onset of right sharp shoulder pain radiating to my right chest, right rib, and complained of right arm numbness and tingling. When I read this, I filed a request to amend my medical records to reflect my reported symptoms. Dr. Wolf reported at 4:10 a.m. that I was comfortable, pain in my back, 4 out of 10. He also explained to Dr. Nelson that my blood pressure had been low. Dr. Nelson arrived at the hospital around 4 a.m. He reported sudden onset of pain in my chest and extending to my right side, yet he never asked me my symptoms. Dr. Maxwell reported that I had crushing substernal chest pain, blood pressure of 180 requiring massive doses of esmolol blood pressure control. He also reported severe chest pain, very hypertensive in the 200s down to 150 with esmolol. Upon arrival at the hospital, my blood pressure was 100/68. It was 109/78 at 12:15 a.m., 117/65 at 1:19 a.m., 97/77 at 2:55 a.m., and 106/50 at 3:35 a.m. According to the medical record, esmolol was started at 4:32 a.m. My blood pressure was 111/74. I was given it at 5:11 a.m. My blood pressure was 87/73, and again at 5:24 a.m. my blood pressure was 105/71. Between 4:20 and 5:20 a.m. I was left in the room alone with no one monitoring me, yet they said I had a life-threatening condition. At 4:33 a.m., the radiologist amended his opinion to likely pulsation artifact. It was reported and faxed to the emergency department nearly 1 hour before I was prepped for surgery. I never had or told anyone I had chest pain. My blood pressure was taken 13 times from the time I arrived at the hospital until I was taken into surgery, which 3 of the readings were hypotensive. The highest systolic blood pressure reading for me was 120, not 200s or 180 as reported by Dr. Maxwell. Dr. Maxwell told me that without the surgery I had a maximum of 12 hours to live. My life has forever been altered because Dr. Maxwell, for whatever reasons, decided to misstate my symptoms to support his diagnosis of a descending aorta. The Arizona Medical Board minutes from April 6th of 2011 are as follows. SK spoke during the call to the public. Dr. Wolf summarized that the medical consultant did not identify a deviation from the standard of care in this case. Dr. Jenkins noted that the history and physical examination was dictated with erroneous information regarding the patient's blood pressure. Dr. Jenkins expressed concern with the fact that the physician may not have had all of his information correct prior to electing to proceed with surgery. Dr. Jenkins also noted that there was an addendum made to the patient's CT angiogram which included recommendations to repeat the test with a different protocol to determine whether the findings were artifactual or a true dissection. Board members recognized that this was a difficult case and discussed obtaining clarification as to whether Dr. Maxwell received or reviewed the CT angiogram addendum that suggests additional testing. Dr. Krishna spoke in favor of issuing an advisory letter for lack of communication, as he found that patient harm has occurred in this case. Dr. Patelin states that Dr. Maxwell's notation that the patient had hypertension requiring high-dose beta blockers was bothersome, as the notation is not supported by the medical record. Board members further discussed the fact that there was an obvious breakdown of communication in this case and questioned where the breakdown occurred. Dr. Lee spoke in favor of returning the case for further investigation. The hearing to review the executive director's decision to dismiss the case against Michael Maxwell was held August 10th of 2011. I prepared a 3-minute speech. Dr. Maxwell performed unnecessary heart surgery on me January 21st, 2010. Dr. Maxwell dictated that I had crushing substernal chest pain, blood pressure of 180, requiring massive doses of esmolol blood pressure control. At no time did I complain of chest pain, nor do I have a history or family history of cardiac problems. 3 hours prior to the surgery, at 3:15 a.m., Dr. Wolf dictated that my blood pressure has been low, 97/77, and the pain in my back is a 4 out of 10. At 4:10 a.m., he states that I am comfortable after additional morphine. Blood pressure still low. At 4:26 a.m., Dr. Nelson dictated that my blood pressure is again 110/60. 6 minutes later, esmolol was started. I received 4 doses between 4:32 and 5:24 a.m. I was alone in the room with no monitors. At 4:33, Dr. Paquette filed an addendum amending his opinion to likely pulsation artifact and recommended further tests. I was taken into surgery. When I woke up, Dr. Maxwell told me he made a mistake. There's nothing wrong with my heart. I suffered complications from the surgery. I developed kidney injury due to extremely low blood pressure and sepsis from the untreated abscess that was ignored. For several months, I experienced excruciating pain in my chest where the surgery was performed. I had over 40 visits to various doctors. September 2nd, I had surgery to remove 3 sternal wires that were protruding up through my skin. It took my everyday pain from a 10 to a 5. I have experienced pain in my chest every day since the surgery. This was not a mistake. Not only did Dr. Maxwell dictate erroneous information in his operating report, he also dictated the same erroneous information in his discharge report. He wrote that I was very hypertensive when I came in, with a blood pressure in the 200s, and it had came down to 150s with an esmolol drip. Was he that oblivious to my care? 13 days after the surgery, did he not realize that my blood pressure never went over 120? He gave me 4 doses of esmolol minutes before performing heart surgery. I could have easily lost my life at the hands of Dr. Maxwell. Dr. Maxwell dictated if he had done an MRI and it came back negative, he probably would not believe it. I was never given the option of more tests. Dr. Maxwell never asked me my symptoms. I was alone and unable to articulate my care due to several doses of morphine, and I was in no distress. This was not a mistake. This was an egregious combination of arrogance, incompetence, and greed. Dr. Maxwell has violated the standard of care and doesn't deserve a medical license. You were quick to dismiss my case without reviewing the facts. I'm asking you today to please protect the public from Dr. Maxwell.